Hello, this is Brittany Davault for SPCE 638, Section 806, Module 13, Bibliography, taught by Dr. Diana Wilson. I chose collaboration with other professionals. The common relevant test content items that I saw throughout reading were E1. We are working with other professionals to be of the most benefit to our clients, using decision-making models that are of the best interest of our clients and treating other professionals with respect. E3. We are familiarizing ourselves with non-behavioral treatments and other disciplines to work best as a team. E8, we are actively listening to other professionals and disciplines to establish and maintain a working and positive collaborative team. For E12, we are identifying the cost-benefit ratio of seeking out non-behavioral services and adhering to our scope of competence and practice when seeking to implement a collaborative approach. H7, we are seeking to establish whether a non-behavioral treatment is effective or how to modify it so that it aligns with behavioral principles in a way that maintains treatment integrity. And H8, we are not immediately dismissing other disciplines because they do not utilize behavioral principles. Articles to cover: we are maintaining professional relationships in an interdisciplinary setting by Broadhead, interprofessional collaboration in research, education, and clinical practice by Green and Johnson, and a behavior analytic perspective on interprofessional collaboration by Slim and Reuter-Yuell. The first article, maintaining professional relationships. What was learned? Number one, yes, we do want to be skeptical on non-behavioral interventions, but excessive questioning could strain professional relationships. Number two, using an approach of curiosity, empathy, and understanding toward other disciplines bolsters the science of behavioral analysis. And number three, Broadhead proposed a decision-making model to facilitate how to approach non-behavioral interventions and whether a BCBA should back it. That is up on the next slide. Here is Broadhead's decision-making model. So first, we're going to identify what the non-behavioral treatment is. Is client safety at risk? If it's a yes, it's an immediate hard pass on that one. But you go through a bunch of questions, yes or no. It's a nice flow chart for how to say yes or no or be skeptical of non-behavioral treatment. Next, we have interprofessional collaboration in research, education, and practice. What was learned? Number one, collaboration was defined when two or more entities work together to produce a desired and shared outcome. Number two, benefits of collaboration in business are sharing costs, reducing uncertainties in supply chains, and forming alliances that foster learning and advancement. Number three, some general benefits of collaboration are opportunities to approach problem solving with new ways of thinking, access to new resources, more efficient working, and cost sharing. Number four, when working in a team, members must treat each other as equals versus one member having more importance or weight. Number five, the potential barriers to collaboration include conflict, which it should be expected. Social hierarchies may exist that lead to prejudice against a professional group. There could be role overlap that causes misunderstandings and confusion, and there could be language barriers. Number six, collaboration isn't always the best choice. Green provides a checklist to assist in identifying when to employ collaboration. Some points include knowing when forming that relationship will lead to better results and knowing what each party will gain from that alliance. Lastly, a behavior analytic perspective on interprofessional collaboration. What was learned? Number one, the article sought to operationally define parameters commonly associated with collaboration, like empathy, cultural humility, and compassion. Number two, poor collaboration not only leads to likely decreased client outcomes, but also negatively reflects the science of ABA. Number three, the leading guideline to approach interprofessionalism is the IPEC, the Interprofessional Education Collaborative. Number four, IPEC was originally developed for healthcare professional schooling. And number five, there were four main models that were identified: the multidisciplinary, interdisciplinary, transdisciplinary, and interprofessional. For the multidisciplinary, providers work and make decisions independently and have little exchange of information about their decision and care. It does promote provider autonomy, and it may expedite decision-making, but it may lead to fragmented treatment. The interdisciplinary approach, providers stick to their expertise area but make decisions as a team. It promotes the exchange of information but requires interpersonal skills that may lead to differing opinions and treatment, of course, which may cause conflict. There is the transdisciplinary. Providers of differing disciplines work together during assessment. Providers release their interventions to a single provider that is overseeing the patient. While this does streamline patient care, it requires an enormous commitment for professionals to keep a high degree of communication, and there are concerns about the scope of practice, maintaining scope of practice. Lastly, the interprofessional, it emphasizes exchanging information, clarifications of preferences, open-mindedness towards options, and weighing preferred to actual options. It increases client outcomes, quality of services, and a work life for providers. Here are my references. Thank you very much.